Good afternoon, everyone. We are going through the MRI angiography anatomy part now. MRI angiography comprises of a circle of Willis, which is an arterial anastomotic network located at the base of the brain and formed by the anterior and posterior circulation. Anterior circulation comprises of left and right internal carotid arteries, A1 segments of left and right anterior cerebral arteries, and single anterior communicating artery. Posterior circulation comprises of left and right posterior communicating arteries, P1 segments of the right and left posterior cerebral arteries, and single basilar artery. Here is the schematic representation of the same, where we can see anteriorly there is this connecting branch between both the ACS called as anterior communicating artery. Then there is a A1 segment of the anterior cerebral artery. This is the internal carotid artery. This is the posterior communicating artery. Then these are the P1 segments of both the posterior cerebral arteries. Thus, the circle of Willis is formed over here by these anterior and posterior circulation vessels. This is a MEP static image of the same, where we can see these are the A1 segments of the ACA. This is the internal carotid and P1 segments of both the PCH. PCOM are not well visualized here, may be absent or hypoplastic. Well, now we start with the internal carotid artery and its segments. Internal carotid artery arises from the bifurcation of the common carotid artery into the internal and external carotid arteries. It comprises of 7 segments. The first segment is called the cervical segment. It extends from the bifurcation, that is the origin of the vessel, courses upwards through the carotid space and enters the skull through the carotid canal anterior to the jugular foramen. No branches are given by this artery in the neck. Second segment comprises of the petrous segment. This runs through the petrous part of the temporal bone. It has 3 components: ascending, genu, and horizontal. It courses up to the level of the foramen lacerum. This segment gives off median and carotid tympanic branches. Third segment is the lacerum segment. As the name suggests, it does not pass through the foramen. However, it passes just above the foramen lacerum, and it is a very short segment. Fourth segment is the cavernous segment. This vessel or the segment courses through the cavernous sinus, and it is surrounded by the abducent, that is the 6th cranial nerve, and sympathetic trunk. Fifth segment is the clinoid segment. As the artery exits the cavernous segment, at the level of the clinoid process, this is called as a clinoid segment of the artery. And here the artery now becomes the intradural. No branches are given by this segment, except in some rare cases, ophthalmic artery may arise from this. Then the artery courses a little upwards, known as the supraclinoid segment or ophthalmic segment, as it gives off ophthalmic artery, which is a very important branch supplying the orbits. Then the 7th segment is nothing but the terminal tip of the artery, which then bifurcates into the anterior and middle cerebral arteries. This terminal segment also gives off posterior communicating artery and anterior choroidal artery. This is a MEP image of MRI TOF angiography, where we can see the segments clearly. Up to this level is the cervical segment. Then in the petrous bone, it has ascending component. Then this is the genu and the horizontal component. Then at the level of the foramen lacerum, it is known as the lacerum segment. Then it enters into the cavernous sinus, forming the cavernous segment. Then at the level of the clinoid, it is called as the clinoid segment. Then on this side, we can clearly see this one. This is your supraclinoid segment, giving off the ophthalmic artery, and this terminal branch is the bifurcating into the ACA and MCA. Another view just to show the origin of the ophthalmic artery from the supraclinoid segment. Here you can see the clinoid, supraclinoid, and terminal segments. Next comes the anterior cerebral artery. It is one of the branch from bifurcation of the internal carotid artery. It courses superomedially towards the midline longitudinal fissure and then courses in the midline upwards, supplying the paramedian frontoparietal lobes. It has multiple segments as below. A1 segment is from the origin, coursing superiormedially up to the level of the anterior communicating artery, which is just at the beginning of the midline longitudinal fissure. It gives off medial lenticulostriate artery supplying the caudate lobe and anterior limb of the internal capsule. ACOM, anterior communicating artery, is nothing but short connection between the two anterior cerebral arteries and the level demarcating the differentiation between A1 and the A2 segments. A2 segment then courses from ACOM level and up to the level of the genie of the corpus callosum, which is running parallel to the longitudinal fissure. It gives off a recurrent artery of Hubner, which supplies the most important structure, that is the internal capsule. Then the artery courses posterior superiorly along the convexity of the corpus callosum, known as the pericallosal segment. One of the important terminal bifurcation is callosal marginal artery, which arises from the pericallosal and supplies the medial frontal branches. Then the terminal or the cortical branches are known as the A4 and the A5 branches. Here is the again neat static image showing us anterior cerebral artery segments. This is the origin of the ACA and MCA. This is the A1 segment up to the level of this ACOM. Then this is the parallel segments, A2 segments, which are coursing parallel to each other within the fissure. And then these are the A3 and cortical branches. Callosal marginal artery is seen here, arising from the pericallosal artery. Another view of the same showing you the better differentiation between A2 and A3 segments. So here the artery takes a backward turn along the convexity of the corpus callosum. Then comes the middle cerebral artery, again arising from the internal carotid artery as its terminal bifurcation. It also has multiple segments. The first one is known as the M1, which is a horizontal segment within the sylvian fissure. Then the M2 segment, which is nothing but the segment coursing through the insula, and it supplies the insular lobe. Then comes the M3 and M4, which are respectively known as opercular and cortical branches. These branches of MCA are supplying the frontal, parietal, and temporal lateral surfaces. Here we can see the M1 segment. This is the genie of the middle cerebral artery. Then the insular segment. Then this is the opercular M3 segment and the peripheral cortical, this M4 segment. Another view showing you better M3 and lateral peripheral are the M4 segments. Coming next to the posterior cerebral artery. This arises as a terminal bifurcation of basilar artery and most important part of the posterior circulation. It also has multiple branches. The P1 is the segment from origin up to the level of the posterior communicating artery. And that posterior communicating artery coming from the supraclinoid segment of ICA to PCA. Thus, it has a communication between the anterior and the posterior circulation. Then from PCOM segment onwards, it is known as a P2 segment, which courses around the midbrain. Then third is the P3 segment, which is coursing through the quadrigeminal system, and it gives off a lateral occipital branch, which supplies posterior temporal lobe. Then the peripheral or the cortical segment is the P4, which gives off medial occipital branch to the medial occipital lobe. Here is again the meat static image. I have just turned it upside down so that we can see the PCA branches very clearly. Here is the bifurcation of the basilar, and you can see these are the two PCAs. This is the P1 segment. Up to somewhere here, we can get the PCOM. However, it is not clearly seen here, maybe hypoplastic or absent. Then you can see the next coming is the P2 segment coursing around the midbrain, P3 segment, and P4 segment. Another view showing you better P3 and P4 peripheral segments. Then comes the basilar artery. Basilar artery is formed by the confluence of two vertebral arteries, right and left, at the pontomedullary junction in the midline. it gives off multiple pontine branches, then labyrinthine or the internal auditory artery. And the most important branches given by this basilar artery are the anterior inferior cerebellar, superior cerebellar, and posterior cerebellar arteries, which are the terminal branches. So here we can see this is the basilar artery formed by the confluence of the vertebral arteries. Here we can see the superior cerebellar artery and bifurcation into the PCAs. The small branch in the proximal segment is the anterior inferior cerebellar artery. Before going to the common variants, we will just go through the axial MRI angiography of images, where first we will go through the posterior circulation. These are the basilar arteries. Here is the confluence of the, sorry, my mistake. These are the vertebral arteries. Here is the confluence of the vertebral arteries forming the basilar artery. These are the anterior inferior cerebellar artery. Then coming upwards, it gives off the superior cerebellar artery on both the sides. And then it bifurcates into the PCAs. And then this PCA is the P1 segment. Then here is the P2 segment. Then coming off here is your P3 and peripheral P4 segment. Now moving on to the anterior circulation. These are the cervical segments of both the internal carotid arteries coming here, giving off petrous segments of the internal carotid arteries known as the carotid canal within the petrous bone of the temporal. Here is the foramen lacerum segment, which is nothing but just communication between the cavernous and the petrous. These are the cavernous segments which are horizontally coursing through the cavernous sinus. Coming here is the clinoid segments. Going above are the supraclinoid segments. And terminal is the last segment. That is the seventh segment. It then bifurcates into the MCA and ACA. So this is the A1 segment and this is the M1 segment of the MCA, which is coursing through this sylvian fissure and then entering into the insula as a M2 segment. And if you can see here, ACA coursing through this midline fissure, moving upwards and then turning backwards along the corpus callosum as a pericallosal artery. Some of the common variants which are seen are the hypoplasia of one or both the PCOM, which is very commonly seen in routine scans. Then the hypoplastic or absent A1 segment of the ACA, which is also commonly seen. Absent or fenestrated ACOM, origin of the PCA from ICA with absent or hypoplastic P1 is also known as the fetal origin of the PCA or the infundibular dilatation of the PCOM origin. So here I conclude my talk on the MR angiography. I hope everyone has enjoyed the same. Thank you very much for your attention.